I'm Geraint Rees. I'm a Professor of Neuroscience at University College London. I'm Dean of the Faculty of Life Sciences there. Today I was talking about what a research hospital is. So that's the idea of how in one part of the healthcare ecosystem we create not just a hospital but a whole load of partnerships that enable us to create new treatments for patients. And I was exploring what the implications of what we already know about how to create a research hospital to create cell and gene therapy for children and adults, how that might then translate into the new and exciting arena of artificial intelligence. Some key points I made. I think the first point is no research hospital exists in isolation. A research hospital is part of a partnership, usually with a university that contains a very large number of people with different skills and complementary attributes, many of which are going to be important for AI. And often it also exists in partnership with companies, commercial entities either spun out from the university or the hospital or partners. And of course, all of that wouldn't happen without patients and public involvement and funding from public and private funders. So it's the essence of partnership that I was hoping to get across, rather than this just being one company or one hospital or one entity doing all these things. The second idea I was trying to get across were the components, not just in terms of structure, but the components in terms of what a research hospital would need to do. So I was explaining it might need specialized facilities, and for AI that might include computing and data storage. I was explaining it would need a way of changing the culture within the hospital to orient it towards these questions for both patients, carers and health professionals. I was explaining it would need academic training at scale and talking a little bit about the Topol review that was going on. There are many challenges for companies and other organisations, small and large, working with the NHS, but we don't need to necessarily reinvent the wheel and equip every single NHS hospital or every single GP practice with a business development function or a contracts function. We have, for example, technology transfer businesses in the UK associated with our universities that are amongst the best in the world. The kind of skills that one needs to create and sustain an artificial intelligence business are there. And so it's less about a radically new and disruptive business model. It's more about joining up the dots and making sure the right people are talking to each other in the right parts of the ecosystem. There are, of course, some really interesting questions about the value of data that we haven't yet fully settled on. Again, my answer to questions like that would be that's more about partnership and shared creation of value, and that value is something that isn't just financial, but is much broader. We know all this from many studies of research. For example, the Wellcome Trust a number of years ago did a study which tried to estimate the value of medical research. And one of the key findings it made was that the return on investment, if you think of it in narrowly financial terms, most of the return on investment was not the research itself creating a treatment or something that added value, but it was inward investment, the creation of jobs, all of the things around, in this case a research hospital or a research institution like a university, that really added value. I think the same will be true for AI, although it's disruptive, faster moving, very exciting. Equally, it's important that we realise that many of the skills we need to create these entities are already here in the UK.